Welcome to Session 1 of We Care, a compassionate response for Ascension Associates. This presentation is brought to you by Ascension, Wisconsin, EAP. Let's begin with a short reflection by a past United States Surgeon General. The oldest medicine in the world is love and compassion. Compassion is at the heart of what we will be talking about today. This is a three-part series. The objectives of this session, Session 1, are to define trauma and determine who might be at risk for stress reactions, discuss the history of trauma response models and current best practice, and define the principles and paradigm of the We Care initiative. In Session 2, we will discuss the how-tos of facilitating a We Care response. And in Session 3, we are going to talk about the importance of self-care throughout this process and offer strategies on how to take good care of yourself. Just a few words before we dig in. This material may not be new to you. Maybe you know some of it. Maybe you know all of it. Maybe you know none of it. The intention is to raise awareness for the We Care initiative, as well as educate associates on what it means and how we can live it out. We ask that you please carefully consider how you can use this information, both personally and professionally. Let's jump in and talk about what is a traumatic event. A traumatic event is an incident that causes physical, emotional, spiritual, or psychological harm. A traumatic event challenges our beliefs or expectations of how the world should be. When a person sees or experiences an extremely abnormal or traumatic situation, it is often normal to question some of our basic foundations. For example, some people might question what is right and what is wrong. Is life fair or unfair? Is the world safe or unsafe? Where is God in all of this? In who or what can I really trust? With that in mind, let's talk briefly about how the coronavirus pandemic fits this description. For many people, this pandemic has caused physical, emotional, spiritual, or psychological harm. Some people have gotten sick and even died. Many people are frightened of contracting the illness, while others are now wary of the news media or government decisions. Many people have new questions about faith, God, or spirituality, and others feel isolated and lonely. The list of impacts goes on. Though there are some similarities between the coronavirus pandemic and a traumatic event, the current situation is a little different in that it is not just one event. It is longer in duration, and the impacts are multifaceted and ever-changing. In some ways, these factors make the pandemic easier to cope with, but in many ways, it makes it harder. Some associates, especially those on the front lines, such as healthcare workers and other essential positions, may begin to feel what the military calls battle fatigue. It may seem like they are fighting this pandemic relentlessly without a break, and over time it begins to feel exhausting and overwhelming. This isn't always typical of a traumatic event, but it is a factor that is unique to our current situation. Who can be traumatized? What we mean by that is who might experience post-traumatic stress reactions. Most obviously, the immediate victim of the circumstances, as well as witnesses or people privy to gruesome details, sights, sounds, or stories. For example, a person may not have been at the scene of a car accident, but they cared for the patient in the ER, saw the injuries, and heard all of the details of the car accident. Even though they weren't the victim or a witness to the event, they may still be susceptible to trauma reactions. It is important to remember that no one can decide for another what is or isn't traumatic. Sometimes we think another person will be just fine after an incident, but the truth is, they're really shaken up. Maybe that person has experienced a similar traumatic experience in the past that is impacting their response to the current situation. We don't always know, and we will have to be careful not to project what will be traumatic for someone. Even if the situation is gory or terrible in some other way, we have to recognize that everyone is unique with different experiences and levels of resiliency. And even the very worst of situations may not be traumatic to some people. In every scenario, it is important to take a person-centered approach and ask them how they are doing and what they need, rather than presume how they are or are not affected. Now you have a better understanding of the definition of traumatic incident, as well as an idea of who might be susceptible to a post-traumatic stress reaction. Next, we will briefly discuss popular models of trauma response, how they compare, and the best practice model developed for Ascension's We Care initiative. In the 1990s, Jeffrey Mitchell saw a need to respond to people who had been affected by crisis and disaster. He developed a process that we now refer to as Critical Incident Stress Management, or CISM. CISM consists of multiple crisis intervention components, including pre-crisis preparation, acute crisis intervention, and post-crisis follow-up. CISM interventions may be applied to individuals, groups, families, organizations, and even communities. Many mental health professionals, chaplains, and other helping professionals have been trained in the CISM model. One component of CISM is Critical Incident Stress Debriefing, or CISD, also known as the Mitchell model. CISD is a 7-phase structured group discussion, usually provided 1 to 10 days post-crisis. It is designed to mitigate acute symptoms of post-traumatic stress, assess the need for follow-up services and support, and if possible, provide a sense of post-crisis closure. Though there has been some criticism of this model, if used appropriately, it is very effective in helping people cope. Psychological first aid, or PFA, is in complement to and fits nicely as a component of the broader critical incident stress management. Some have called PFA a replacement for CISD. If you remember, CISD refers to the structured 7-phase group debriefing model. However, exclusively choosing one model over the other is not necessary. Both models have strengths and are useful with different individuals in different situations. The basis of psychological first aid is caring about the person in distress and helping them feel calm and supported. It involves active listening and, if needed, providing practical assistance. Understanding crisis reactions and knowing how to help others also empowers helpers, since they can apply these skills to their own crisis. Here is a side-by-side comparison of the two models. The philosophy of CISD is to mitigate acute symptoms, assess the need for follow-up, and, if possible, provide a sense of post-crisis psychological closure, while the philosophy of PFA is to normalize reactions to stress and trauma by offering emotional support and attending to immediate needs. CISD is offered in a structured, formal format, whereas PFA is more flexible and individualized. As we discussed, the structure of CISD and PFA is very different. CISD is delivered in succinct stages, including an introduction, fact phase, thought phase, reaction phase, symptom phase, teaching phase, and reentry phase. PFA does not have phases at all. Instead, psychological first aid is based on 12 principles that include making a connection, helping people be safe, being kind, calm, and compassionate, meeting people's basic needs, actively listening, giving realistic assurance, encourage good coping, help people connect, giving accurate and timely information, making a referral, ending the conversation, and finally, taking care of yourself. Section 2. Regardless of which model you use during post-trauma or crisis response, there is widespread consensus and support for 5 key aspects of helping: ensuring safety, promoting calm, promoting self and collective efficacy, also known as resilience, which we will discuss in a later session, promoting connectedness, and promoting hope. It is always important to keep these aspects in the front of your mind whenever you are responding in a helping capacity. The Ascension We Care response has considered all the evidence-based best practices for supporting those in distress, whether it's after a crisis, during a pandemic, or just in the day-to-day struggle. Because we care about our associates, we have adapted widely accepted models to our unique healthcare environment and termed this unique response We Care. The We Care response is not structured, as in CISD, but it is very person-centered, meaning that the helper or support person will take the lead of the person they are helping. The We Care response is not a debriefing, but rather is a way of being with people in distress. In many ways, the We Care response is closely aligned to principles of PFA. The Ascension We Care response is simple: to comfort someone in distress, help them feel safe and calm, assess their needs and concerns, protect people from further harm, provide emotional support, address immediate basic needs, and help people access information services and social support. Why does Ascension want to provide a We Care response to associates? The fundamental reason is to help someone in distress. A We Care response can help people feel calm, safe, and secure. It is humane, caring, and compassionate support that relates to both emotional and practical needs and concerns. Ascension understands that there are times when associates have experiences that feel overwhelming and can interfere with their usual ability to cope. Through active listening, the helper works to identify what the associate needs to manage their situation. For example, this could be helping them organize their thoughts so they can better prioritize their needs. These needs may be practical, such as a snack, a walk outside in the fresh air, or a calm place to take a break. Needs may also be emotional, such as needing to cry or talk about what has happened and to feel heard and understood. Other ways of helping are linking the person to loved ones or supportive teammates, or helping them access information and services that can help. An important aim of We Care is to make the person feel they are supported and connected. This will make them feel stronger and better able to manage their challenges and be able to care for themselves. Though some may feel intimidated to use and practice the We Care model, there really is no need to be. We Care is not something only professionals do. It is not professional counseling or therapy. It is not the aim of We Care to ask for explicit details or encourage an analysis of an event or situation that has caused distress. And it is not intended to pressure people to talk about their reactions and feelings to an event if they do not wish to do so. We Care is truly intended to be a compassionate, fully present response to those in distress. The Ascension We Care model has 3 basic tenets: look, listen, and link. These 3 tenets make it easy to remember the process of facilitating a We Care response. The first tenet is look. What has happened? What is happening? Are there any safety needs that need to be attended to first, including things like active shooters, uncontained illness, open wounds, and other things that must be attended to immediately? Safety always comes first. Once the situation has been stabilized, look around to consider who needs help, who has immediate needs. What are the emotional reactions of the people involved? Where should you invest your efforts first? After you have taken inventory of the situation, next it's time to listen. Start your approach. Introduce yourself. Ask an open-ended question such as, "How are you doing?" Actively listen to the person and validate their feelings and experiences. Maintain a calm demeanor and remain person-centered. Ask what they need now and brainstorm ways that they can get their immediate needs met. Don't try to fix them or handle situations on their behalf. Simply be an empathetic support person and show that you care. Finally, link or connect to resources. Sometimes the person would benefit from a connection with a close family member, friend, or supportive teammate. If there are practical or immediate needs, help to facilitate a resolution if possible. Give information about other resources and sources of support, such as your employee assistance program, hotlines, or support groups. Let them know they can reach out to you again if they need to at a later time. These are the 3 basic tenets of the We Care model, and we will go over each of them in more depth in the next sessions, so you feel fully prepared and ready to go out and practice this model on your own. You may be wondering why Ascension is instituting this We Care response now. Why is this important? Well, this is a unique time in our history, and healthcare workers are on the front lines. During this coronavirus epidemic, many in the healthcare field, including housekeeping, food service, administrative and support staff, are knowingly at risk of exposure to the virus, yet they still come to work every day anyway. As demand for healthcare increases and supplies of PPE decrease, providers may be faced with the moral dilemma of deciding who gets treatment and who doesn't, and other kinds of highly distressing decisions that may contribute to a sense of moral injury. Not only are there increased patient volumes, but healthcare workers have home lives too that can impact their stress. Shutdown of normal society operations may mean less income or less access to services or outlets. Social distancing increases isolation and decreases support from family and friends, especially at a time when support is needed most. In addition, things are changing almost daily, and the stress from it all can be overwhelming and even exhausting. Healthcare workers are helpers, healers, and some have even said heroes. They are problem solvers, fixers, and often self-sacrificial. They put their needs to the background to attend to others because they care. It might feel strange to them for others to ask them what they need. Our helpers and support people are undoubtedly stressed, but may not even recognize the impact of that stress on themselves. Not to mention, their prolonged impact of stress will compound over time, and an early intervention could go a long way to mitigate effects of post-crisis reactions, moral injury, compassion fatigue, and burnout. We have to take care of each other. The We Care response gives us a clear strategy to do just that. As a support person, you have a very important role to our Ascension healthcare system, our healthcare providers, and other associates, and ultimately to the patients that we serve. A caring, compassionate response is needed now more than ever. We are all in this together. Will you take the next step? I hope you have enjoyed Session 1, Introduction to We Care. Please join us for Session 2, the how-tos of conducting an effective We Care response, as well as Session 3, Taking Care of Yourself. I want to quickly remind you to visit your Ascension Ministries COVID-19 Associate Self-Care site for additional resources, information, and support. On behalf of Ascension Wisconsin EAP, I want to thank you for your time and your investment in this initiative.